it's hard to move your neck from side to side, back and forth, and there's some pain there. Maybe you tried like a new workout at the gym, or you were lifting something heavy or lifting heavy boxes, just doing different movements. And shortly after, you get pain in your neck, maybe in the back, maybe in the side, and you've got restriction of movement. Well, I'm going to tell you what's going on and what you can do about it. Guys, I'm Dr. Jen. It's good to see you. Okay, there are a lot of muscles in the neck. So there's a lot of muscles that can become strained or sprained with certain activities, okay? First thing is I love heat for like muscle strains and sprains in my neck because oftentimes it feels stiff. So I like to use a little bit of heat to try to, I don't know, sort of ease some of that pain up. Now, make sure that when you're using a heating pad, etc., that you're using it appropriately. I have a whole video on heating pad mistakes. I've seen some really bad skin burns from people misusing or using too much heating pads, okay? If you like ice better, go ahead and use that, but I typically like heat. The other thing I recommend that you do is an anti-inflammatory, as long as your doctor says it's okay to use them. Things like ibuprofen, Motrin, naproxen, naproxen, things like that can help sort of lower the inflammation that you may be experiencing in the neck muscles, okay? But also, well, before I get to the next part of the treatment, let me tell you some warning signs that should really prompt you to see your doctor ASAP. Don't go anywhere because I'm going to get back to the treatment. But look, if you've got neck pain accompanied with headaches or dizziness or blurred vision, double vision, fever, chills, that's an automatic ER, see your doctor ASAP type of situation. If you've got neck pain and stiffness and you've got numbness and tingling anywhere in your body, your upper extremities, that's an automatic ER, see your doctor situation immediately. If you're weak, like if you've got neck pain and you can't hold on to things, you're dropping things, oh my gosh, those are warning signs, okay? Not all neck pain, pulled muscles, etc., are created equally. But if you have any of those signs or symptoms or other things that are worrisome, you got to see your doctor right away. And that does not apply to this video. Okay, but back to the treating of the pulled neck muscle situation, in particular, stiff neck. We talked about heat, which I love. Also, anti-inflammatory, which can be really great. The other thing is stretches and sort of gentle exercises, okay? Love this, and it's super important. Now, first of all, I do not want you doing strenuous activity. I do not want you to keep doing that gym exercise that got you into this place and into this situation in the first place. I do not want you to resume heavy lifting. I want you to take a break from strenuous and exacerbating activities. But neck exercises, some gentle stretching. I love putting, if you put your chin to your chest, just try. Okay, sometimes you might only be able to get here, but every day try to do some gentle stretches multiple times a day, just briefly, and see if you can move it further. Same thing with neck extension, okay? The other thing I love is rotation. You want to turn your head to each side and see if you can sort of get more range of motion with each time that you do it. It's going to hurt because chances are with this pulled muscle, you've got some stiffness and some pain, right? That's what comes along with it. But these gentle stretches where you try to sort of increase your range of motion. Other thing I like is side bending, okay? Try to put your ear to your shoulder, okay? On both sides. Love that. Also, some shoulder rolls, because oftentimes when we have sort of the neck muscle spasms and pain, it oftentimes can radiate into the shoulders. So doing some sort of shoulder rolls can be very helpful. Gentle massage can be very helpful too. Also, if those things sort of like initially don't make the cut, I'll often prescribe muscle relaxants to my patients. You can also try Tylenol. Tylenol is not an anti-inflammatory medication, but it may help certainly with the pain, okay? Now, let me tell you, a sort of a uncomplicated muscle strain or sprain, pulled muscle in the neck, it should really get better after a few days, okay? If your neck pain does not get better, you got to see your doctor, all right? If it persists, if it doesn't fully go away, and like I said before, if it's accompanied by any of these other signs and symptoms I mentioned, or something ain't right, weakness, muscle, any of that stuff, that is scary stuff, you see your doctor. Most of all, I got to say, remember, I am not your doctor. You got to see your doctor and take your doctor's advice. This is not meant to be medical advice. I'm telling you what I do with my patients and what can be helpful. Run everything by your doctor. Guys, I'm Dr. Jen. Hope this is helpful. Please subscribe to my channel. Click the little bell for updates. I'm on Facebook, Instagram, LinkedIn, TikTok, WhatsApp, Threads, you name it. Please follow me there, Dr. Jen Caudle. Follow me on Facebook if you have not already. Sign up for my free health newsletter at drjencaudle.com. All right, guys. Love y'all.